Good morning and welcome. My name is Brandon Laws and I'm the Director of Marketing at Xenium HR. I'm your moderator for today, and today's topic for our webinar is Addiction in the Workplace, How Employers Can Help Their Employees. Before I do an introduction for Betony, I am just going to do a little bit of housekeeping before we dive into the topic. Today's webinar is about 45 minutes in length in terms of the presentation. We may, give or take maybe 5 minutes on either side, but we will do a Q&A. We'll try to stick to about 15 minutes, so this will be an hour long. We'll end right at 11. If sooner, great. And in the meantime, throughout the presentation, as Betony is speaking, feel free to use the chat window on the GoToMeeting or GoToWebinar panel, and you're able to ask questions throughout the presentation. I'll be monitoring those, so feel free to just add in any questions that kind of pop into your head, and I'll save those for the Q&A portion. So you're welcome to submit as many as you like, and we'll try to get to all of them if we can. And if not, we will probably respond to them after the webinar. A question we always get is, are the slides and recording available? And absolutely, we'll make the slides and recording available. Slides will be ready right away, so if you need to get those in your hand, absolutely, we can send you those. The recording may take a day or so, so within 24 to 48 hours after this webinar is over, we'll have that ready for you. Another question we get is HRCI credit. This one is pending. We don't have it approved for one credit yet, but I anticipate that happening soon. So if you do want a certificate, shoot me an email at brandon.laws@xeniumhr.com. I'll get you a certificate for this. And then for other alerts about our events coming up, webinars, and a lot of podcasts that we have out there, go to xeniumhr.com, go to the blog section of the website, and tons of content, free content that you can get. And now I'd love to present Betony Jacobs to you. She is a family therapy program supervisor at DePaul Treatment Centers. She's a licensed clinical social worker, has 13 years of experience working with individuals and families, and she uses her passion and experience to empower families to attain their goals. So it's really, really nice to have Betony, and I'm going to turn it over to her, and I'll let her control the slides. And Betony, you're on.
Hi. Yeah, thank you, Brandon. Let's see here. So why don't we get started? So first off, I thought we would just do a review of addiction and what it is. There are a variety of ways to explain it and definitions, and starting with the definition from Webster's Dictionary. I'm trying to move my slide. Let's see, I'm having a little technical difficulty moving through the
Sorry,
slide.
Betony. I'll activate it for you.
Is that working yet? There we go. Okay, up and running. All right, so I can think more quickly sometimes than I can speak, so I'm going to try to slow down. Yeah, so we start with a definition of addiction. There is the Webster's definition, which is talking about the compulsive need for and use of a habit-forming substance. These are typically considered the illicit drugs and or legal drugs, alcohol, nicotine, and characterized by tolerance. So, and the physiological symptoms. Now, the problem with this definition is it doesn't include things that are not substance related, but it is a working definition, especially identifying things such as tolerance, which is something that we look for when we think about the difference between just regular sort of, using of substances, consuming alcohol, the most commonly used substance, versus of getting an addiction to it. Having a tolerance is one of the signs when people need more and more of the substance to achieve the same effect. Another symptom of it is also the withdrawal piece, and that's the physiological symptoms upon withdrawal. And that's an important piece that we look at when we consider if someone is actually forming an addiction or has a physical response to it. Another working definition I put up in here is around addiction is a disease of the brain, and that's not identified in the Webster's Dictionary, but that is a very common way of looking at addiction for addiction professionals when we think about that the brain is actually changed because of the substance use and or other addictions, and that the behaviors associated with it are usually the things that people notice and have. That's the stuff that usually impacts families and friends and the work environment. We're moving through these slides, I hope. The next piece to kind of look at here, as soon as it gets to it, is about just the different types of substance abuse disorders that have been classified, and there's a pretty extensive list here, and then there's also included in the DSM-5 the newest version of how we basically do assessments and qualifiers for creating the substance abuse problem. We have included in this is things that are non-substance related, like gambling. And then here, this is a time to think about when, well, one of the things that we got from the DSM is within assessment, some people might actually move through their stages of use. And so they have differential diagnoses between mild, moderate, and severe. And so that folks that are perhaps coming in with some very acute symptoms might be considered severe substance abuse, but then enter into recovery and reduce their use, minimize their use, and they can actually move down and have a differential diagnosis as they get sober. So these are pretty extensive. I think we'll just move through that to the next piece here. This is a little bit of information about the impact that alcohol and illicit drugs have in Oregon. This is a recent release, a couple of years old. The thing about statistics is they, you can only gather an extensive for a period of time, and then it kind of dries up for a while. But here we have in Oregon some important stuff about how many individuals 12 and older in 2013, 2014 were dependent on or abused alcohol within the year. It looks like about 7% of all individuals in this group that were surveyed had an abuse issue. And then we have in Oregon about 99,000 individuals aged 12 and older in 2013 to 14 were dependent on or abused illicit drugs within the year prior to being surveyed. So pretty extensive people. That's about almost 3% of the population. Then again, we have ages 21 and older in Oregon. We have about 6.5%, just under 6.5 or 6.2% of adults per year were reported heavy alcohol use within the month. And what we consider heavy alcohol use is usually, if for men is considered 5 drinks and over daily, and for women 4 drinks per day. And that is usually considered heavy alcohol use. And then, so we have I think the next slide is talking about treatment. And so of the folks that have reported this level of alcohol use and substance use, we have another report here that identifies how many people actually get treatment. And so here is an 8% received treatment for alcohol use in the state of Oregon, when 92% did not receive treatment of the people surveyed. So pretty low, pretty shockingly low in terms of how many people are actually accessing the services that are available for alcohol and for illicit drugs. We have a little bit higher there, 10%, or almost 11%, but still very low. So if we can see that light blue, that's how many people are actually receiving services for their addiction, for substance use addiction. Okay, one more slide here. I don't have any statistics in a pretty form there regarding the opiate use specifically, but we do notice that alcohol still remains to be the most concerning, most prevalent use, and we had a report, again, pretty outdated, but I don't think it's changed much over the years. We have the cost of excessive alcohol use nationwide. Most of that is referring to loss of productivity, and a lot of it is referring to healthcare costs as well, actually. So it does impact businesses directly through that, and how folks will use the insurance policies, medical leaves that are available, as well as just their family members might need the same needs. I'll talk about that in a minute, actually, and how folks will not be performing to what the organization standards might need, and that cost. So here in the opiate use, we're looking at an increase. It's on the rise in many different ways nationwide and in Oregon. We're experiencing what people have been calling the epidemic of use of opiates, and this includes prescription pain relievers as well as heroin. So this, in the past, one of the things that has been showing up is in the past we would consider this to be afflicting some folks in, perhaps in the urban settings, but actually what we're noticing in these years is that it's affecting middle-class folks in non-urban settings, and we have a report about even privately insured folks and the increase in that, how many folks are coming in with needing legitimate reasons for using pain medications, and the increase in dependence on these medications. Let's see, we have a report here about the database of over 20 billion privately billed healthcare claims, are identifying trends and patterns in the epidemic among the privately insured population. And so it's becoming a pretty big issue statewide. So moving into the workplace, we are looking at some of the things that can happen now. Primarily, in relationships, we notice that folks that are concerned about someone who's using, the impact it will have there. Now this can be coworkers and family members and supervisors, supervisees. There's a significant impact on the level of trust will be sacrificed. Boundaries is up here because of how folks might try to be helping and supporting each other, but it actually can come off as feeling like you're sacrificing your own needs when you're worried about someone else. These are dangers that can occur, becoming a little bit overly involved in people's successes in the workplace, which extends to that place of covering up or lying for the other person. Perhaps this, many examples I hear from family members are very concerned that they might lose their job, and so they will take the extra step to contact employers for them, calling in sick, making up excuses for their lack of attendance, and therefore will also be impacted because they are now kind of hooked into that that process and that system of calling in, and also sacrificing their own needs, and maybe they have to go to work. And so therefore it's kind of like this little train. It goes from, first your trust is sacrificed, and then you start breaking your own boundaries and you cover up for the other person, and then that can lead to resentment. Also, there's a lot of confusion and anger that can occur, not sure why someone is struggling that way, how they might be prioritizing they're sacrificing their employment, they're sacrificing their relationships. It's non-logical. It doesn't make sense, and we can get pretty frustrated with each other when we are trying to help someone make better choices. This preoccupation and distractibility, that can be for people who are concerned, might be overly occupied with the well-being of another person, and that can affect their ability to focus at work, ability to even engage in social interactions that don't revolve around the conversations of the person that's using, and yeah, it can take up a lot of time. Something I didn't mention in the cycle of abuse is how this actually relates to a person who is using. So there's three kind of ways that, well, there's not three kind of ways. There's like three stages we consider for someone who's, you know, going through the cycle of abuse, or what we would say is addicted to a substance. And the first stage is preoccupation and anticipation, which is the looking for the drug, either mentally or physically looking for the drug. And then the next stage is intoxication, or being under the influence, and then the last stage is recovery or withdrawal. And so we'll see family members go through the same things, coworkers go through the same things. When you're not near the person, you're thinking about them. When you're with the person, you experience that relief that they're safe. And then when you see them under the influence, is that that downward spiral that affects you emotionally. I'm going to move on to the next slide here, which is around what you might see in the workplace. So yeah, so it seems pretty clear, you know, one of the unfortunate side effects to being under the influence is that you'll have a reduction in productivity. This might look like not showing up. It might just be showing up tardy or leaving early. There's a significant impact in, you know, just your availability when you're even at the workplace. This could be, you know, taking lots of breaks, or maybe even as extreme as taking a nap at work, but needing to kind of come to that place, either if you're under the influence or if you're recovering from your quality of work might be suffered. If you are coming from a after effect, like a hangover, you might not be making the best decisions. And so you'll poor decision making, and interactions with coworkers might be affected. You will be less, sometimes the effect of substance use, we know, will have a major effect on people's emotional, and so just being able to communicate effectively with others, having good problem-solving skills. Extreme cases, and when it comes back to like the cost that it can have on businesses, we're talking about safety issues if someone is using at work. I didn't do that. It's moving through my slides, and I'm not sure how. Oh, okay. So yeah, there's these sorry about the safety issues and health. And now when we talk, I put it all in one, but it's actually kind of a big issue. You know, you have the on-the-job use, which could create injury. Even if they're recovering, you're just, you know, your motor skills might be affected, and accidents on the job, but also health in terms of, you know, needing to see the visit healthcare professionals more often. Lots of things can happen with the excessive use of alcohol specifically on the body. And so you might be experiencing other things that don't seem like they're directly related, acid reflux and agitation of things that would, like, you know, increase blood pressure. And then another extreme is, you know, illegal activity. Theft can occur from people thieving, maybe to even supply for their own needs, or maybe just, again, poor decision making. And in extreme cases, having visits with folks that are also under the influence. Okay, now we're ready to move to the next slide. And so consider, you know, this is a whole nother training in itself, I would think, about family members that might be living with someone who is using a substance abuse or abusing a substance abuse, because they might suffer significantly, and therefore that will impact their work experience. We have noticed that family members will use extensive PTO to stay home and care for another person. That when they're at work again with that preoccupation, they will have lack of focus and not be able to complete tasks as efficiently as they were before. There's a report here from Kaiser that found that family members of patients with substance abuse disorders had a high healthcare costs and were coming in with their own medical conditions that were prompted by their concerns for another person, and spending like extraordinary amount of times in healthcare offices or at home. Family members report symptoms of depressions and anxiety, again, all impacting their ability to work and have healthy relationships with others. Okay, so coming up here is just some common signs and symptoms of folks that if they are under the influence, you might be able to notice. This is directly under the influence or perhaps even withdrawal depending on the substance. So pretty, there's some observable things that you can look out for. Let's see, some of this. Yeah, so I kind of put them into classifications. So not all of this applies to all substances, but when you're looking at depressants in general, you will, the heart rate will slow, and so things are kind of slowed down. Speech might be slower to the point where it might start out a little bit slower and then actually become hard and inaudible at points. You'll notice that this theme here for depressants, which are alcohol included and prescription drugs as well, are just slow is the theme. So movement will be slower, and even falling asleep or really unable to keep the eyelids open and alert. And you'll notice, especially when they're non-engaged, because that's the hardest time to, I guess, move through a conversation. If you're talking, it's easier to look like you're engaged than if you're just sitting still. So like meetings, for example, you'll notice people's bodies change if they might be under the influence. There's a lot in here around, flat affect is important. That's specifically related to things like opiates and a little less to maybe what you might find in alcohol intoxication. Something really particular for opiates is the pupils will be constricted and won't respond to light. And that's pretty unique for that particular substance. And it won't. And the best probably tell for alcohol is the smell. I'm not sure if I put that on there, but yeah, smell is relevant and probably the best thing to look for. But despite that, there are ways around smell, and so you might be looking at other things, and behavior changes are really important to look for. Let's see, stimulants show up differently as you expect. I'm sure you would expect. They're a little bit more elevated symptoms. So you'll see people talking faster and moving a lot if they're under the influence. Now, sometimes even folks that are not under the influence but have been drawn to that particular stimulant might still be moving a lot and feel a little bit more jagged in their movements. And the opposite will occur with pupils. They'll actually be more dilated, even in light. And some other symptoms might depend on not only the drug, but how the drug is consumed. Things like sniffing and runny nose is usually for if someone is actually sniffing the drug. And another important thing for stimulants is it tends to lose appetite. It'll be less hungry, so you'll see that change there. And then isolated, just marijuana. And again, marijuana is an interesting, has interesting effects on people. It can affect different people different ways. But these are some things that might occur if someone is actively under the influence of marijuana. And there are ways to cover some of these things, but the smoky smell is a pretty common occurrence. It won't just be, it'll sort of be like on the clothes and follow hair and things like that. And so, good way to look for it. And the next piece here is more geared towards long-term changes. So if someone might be under the influence, it might look very differently than when someone's been using for a really long time. And we're back to that place of like tolerance and forming of an addiction. How we refer to addiction is over time usually. And these are changes that can occur, behavioral changes. You'll note, if you've known someone for some time, you'll start to see the personal appearance might change. They will look weight gain or weight loss. Oh goodness, how did that happen? Oh, I apologize, group. I hope everybody's very patient with me. I'm not sure how I ended up 3 slides ahead. Okay. Nope. Oh, there we go. Okay, we're back on track. Oh, no, we're not. I'm sure it's my computer. It's just a little bit slower than my hand. So we have, yeah, so when you have noticed, yeah, so weight gain, weight loss is something that I was going to say, or just in general appearance, putting, if you show up to work in your clothing that is work appropriate, but then it starts to look different. You start to maybe change how you dress even, and then mood swings and attitude changes, and has a lot to do with interactions with others, and then the emotional regulation piece that I mentioned earlier on, and if folks are in high emotional reactivity or depression, and the withdrawing from responsibilities and withdrawing from coworkers and folks that might have been more engaged in exercises and activities and socializing, and then finding that that's different. And there's the defensive attitude that can come up. That's really kind of a considerable change that might occur if folks have been approached more, or find rationale for using. Defensive is actually a pretty strong word. It might just be more rationalities and minimizing of any kind of topic or anything that's focused on the topic of the substance use, so whatever that drug might be. You'll hear in comments, things like, well, at least it's not this, or only this, I only drink on the weekends. And some of that talk might indicate some changes in the person's behavior. Okay, I can. Okay, so here we have the bulk of what I think we're looking for is steps that coworkers and leaders can make in the workplace. So this is really, this is like organizational opportunities. One might be just, how does the workplace address and promote health and wellness? Are there visible signs? Are there, like within the agency, that will make this a priority for the company? Are there activities, things that the coworkers can do together that actually supports the overall wellness of the agency and individuals in it? And this can be from anything from like how all staff meetings are conducted to out of the office gatherings, which is touching a little bit on the company culture as well. Like, is the company culture supportive of this environment, of a sober living environment or a recovery-oriented environment, or is part of company culture pretty accepting of the use of alcohol or other drugs? And what would that mean for the company to make some changes around that? Are they dealing with a person's, if the agency is concerned about one person's use or the use in general at the place of employment? And then I'm going to come back to this organizational belief system here, which is really kind of targeted at how does the organization even approach the concept of substance use or addiction? Is there a belief system about why someone can become addicted? You know, is it focused on that that it is the concern, that it is a disease of the brain, that there are biopsychosocial realities that exist for addiction, or is it considered a morality issue? And as the organization, if this really takes some exploration of the organization, is candidly have a discussion about how is this even approached in daily conversation or from leaders. And if employees see that this is, that there would be a place to go, a safe place to go to talk about their relationship with drugs and alcohol, be more likely to seek support. Confidentiality and respecting the cores, confidentiality as a core value of the organization would be important. If people talk about addiction, will they be talked about later if they went to a coworker or a supervisor and were opening up about their use? Would they feel like that information was safe in the company's culture? And here's some other suggestions about, folks that are in recovery, employing folks that are in recovery or have been to treatment and have had some success in sobriety. That might be something to do, again, that kind of looks back at what's the organizational belief system. If you know that someone's in recovery or have lived with an addiction before, will they be welcomed in this agency? And if so, I think it can definitely benefit the agency as a whole to promote health and wellness and recovery-oriented behaviors. There's some pieces about training supervisors and how to see the signs and how to talk about addiction with their employees. There are specific trainings for that, not only for just supervisors, but for coworkers, perhaps, that could learn how to approach their colleagues and very great, fun photo here. I love about a little bit specifically around the organization and their goals. I didn't mention this. I didn't highlight it there. But does the organization have a policy about drug and alcohol in the workplace? And even if they have a policy about drug and alcohol while under, while actively working while under employment, do they have a drug and alcohol policy outside of the workplace in terms of gatherings, and holiday parties? And if so, one recommendation is to monitor how much people drink if you serve alcohol at a party. And then, of course, safety first. And consider that if alcohol is being served at a company party, that people are taken care of and have options for not driving if they've been using alcohol. It's a great photo. So here we are working with folks that you might that you already know are using substances, alcohol or other drugs, either on the job or might be coming in and you're concerned about what they've been doing, that their work performance is starting to be affected, or you know them personally and are concerned about them as a friend or coworker. By far one of the best things that can be recommended is having an employee assistance program. Someplace confidential. EAPs are confidential. I'm sure many people are aware of this program. And being real, again, this kind of comes back to how obvious is this in the workplace? Does every employee know that this is an option, and is it put out there in an effective way. I keep thinking of like visuals, in the workplace, signs that this is an acceptable opportunity for everybody, that there is no judgment to seek support, and that having a drug-free workplace is a value of the agency, and so folks know how to access it easily. And then employee education about addiction. So this kind of extends to, do folks feel like they can talk about addiction with each other, and you should talk about substance use and the signs and the impact that addiction and using substances can have on the workplace and have on their coworkers and their family members. And again, about the policies. So is there a policy in place at the agency? And if so, does everybody understand it? Is it clear? Do people know what the expectations are of them as workers? And what will happen if they are under the influence at work? Now, if people are making the decisions to come under the influence of work, it probably is a sign that they're not making healthy choices, and that it's probably not just out of defiance. It's usually could be one of the signs that someone does need support and treatment. And so making sure that folks have clear understanding about what those treatment options are, and that they could go to a person and talk to them and feel like they have the company's backing to take the time off. A big fear that people will have going to treatment is, will they lose their job? How are they going to pay for things? And so if there's means to support someone taking leave to do outpatient or something even more, a higher level of care, does the company say that that is something that they can provide, and make sure employees know that they can speak to someone about those options. These next two pieces, keep track of employees' performance, and talking about the unsatisfactory job performance is definitely related to that boundaries that we touched on in the beginning and how important they are to have. So the consequences perhaps for even talking with somebody, not the consequences, but the consequences for using substances and will be, directly impact someone's performance. And sometimes it takes really feeling those consequences, I think, for folks to know that the use itself is not outweighing the other things in their life that they find rewarding, employment, relationships, and that sobriety, hasn't been as pleasurable or as rewarding as being under the influence. But when we start to feel things fall apart, work and family relationships are two of the primary things that will someone will start to become motivated for change. Really start to question if this continuing process is worth them going down, or if they could maybe seek some support and find ways to change it. And so being able to communicate, tracking the performance and being able to clearly identify that this is not meeting the job expectations. And the informally talk about this is really, the informally talk about employee with about their performance is, this isn't necessarily something that everybody would do or feel comfortable doing, but it might be an opportunity to open up the dialogue a little bit, so it's not coming off as a reprimand, but more of a opportunity for an employee to disclose. Non-confrontational is interesting. I put it as one bullet when really it should be an entire slide, and being compassionate as well. So motivation for change usually occurs. We've have really found much more successes when folks are direct and compassionate. Things that don't work are confrontation and any kind of, I guess, assumptions or belief systems about the cause of someone's behavior that would attack their character or their value system. So people will respond when they know that they are being noticed, that the behaviors are impacting the workplace or the relationships, and and they feel like they're being spoken to directly, and that the person who's speaking to them does care about their well-being, and being able to move into treatment does require support. And so even having support in the workplace, other people to talk to, having friends that they can confide in, coworkers they can confide in, will go a long way for someone believing that the workplace knows that they can be successful. A lot of this has to do with just being direct and having really clear communication between colleagues and supervisors. Oh, shoot. Thank you. I have a colleague here helping me work the system here. Okay, so this is actually interesting. This is our last slide, and I didn't think we'd go through this as quickly as we did. But this is about some other opportunities for people to get support for themselves. I'm going to spend a little time talking about craft. And Al-Anon is a 12-step program that has been formed out of the the original 12-step programs, which is Alcohol Anonymous, AA. You'll see the Al-Anon is actually from the Alcohol Anonymous, for family members to go and get their own support. They will talk about powerlessness and how they cannot make someone get treatment for themselves, but they can actually find support for themselves into making better choices when responding to someone they care about who has a substance use disorder. Community Reinforcement and Family Training, CRAFT, is a much more structured program that I have here. Robert J. Myers, you can visit it. It's a site online, and he also offers trainings locally and at times locally, has been to Oregon a few times. And it's regarding how to support and change people's behaviors when they are concerned about someone with a substance use disorder. I have worked with coworkers before, without telling too much information, had a group of 3 coworkers come into the office to visit with me and learn about craft when they were very concerned about their colleague they'd been using, and concerned that they didn't have anybody, that the person they were concerned about had nobody at home that was paying attention or caring, but had like an adolescent daughter. And so they came in and wanted to figure out ways to talk about their concerns and what they thought they could do to help her make better decisions or even seek treatment. And that is what craft is about. It is really skill focused. It is communication focused. It is relationship focused. It's to figure out ways that you can respond to the behaviors that you see and support in a compassionate way. And then hopefully increase and influence the person you're concerned about choosing treatment over the continued behavior of use. And it can take some effort, so it's usually recommended for people who are pretty close to the person you're concerned about. But I do think elements of this affect everybody, and just really paying attention to the direct positive communication skills that we can use when talking about addiction, and staying compassionate. And that's a key piece to folks feeling like they can seek treatment and keep their jobs and their relationships. So I think, unless I'm mistaken, that was the last slide that we had here. So thank you very much, and I know that I tried to get a lot of information out there, and want to know if there's any
That was
questions.
great, Betony. Thank you. And I'll jump back in for the moderation portion. Real quick, there was a question that we had come in that was when you were defining some of the mood, the behavior changes and whatnot, the question came in about defining what labile means, or labile. I haven't actually heard that myself either, so this would just be great to just define what that actually means.
Oh, sorry.
And I think it was in just terms of emotional swings, possibly.
Yeah, yes, yeah. Well, now I'm wondering if did I spell it right?
No, I think that is
Yeah,
right. I looked at the definition.
okay, good. Yeah. Um, yeah, it is definitely like when you'll see somebody kind of fluctuate. Um, and so, like, I can't remember where the slide is, but like changes and mood.
Mm-hmm.
Hmm.
Yeah. Perfect. Thank you.
Yeah,
So real
you're
quick
welcome.
before we dive into the other questions, I want to invite people to go to the chat window, ask some questions. We have several that we'll get to in a second. I also want to remind you that we are recording this webinar, and we'll get the slides and the recording out to you, those who've been in attendance, so you can share with your team. And this is really great information that Betony that went over, and I'm sure you need
Okay.
to review it several times, so the recording will be helpful for that. And then one other reminder, HRCI credit, if you do want a certificate for that, shoot me an email at brandon.laws@xeniumhr.com and we'll get you that. So now for the Q&A portion, we have several questions. First one comes from Chris. When you talk about the stats early on, are you seeing a particular trend in one area or another? I know a lot of the statistics were a little outdated, but are you just in your profession seeing something that's spiking in the current times?
Mm-hmm. Yeah. So right, and I do apologize that a couple years old really feels like it's old. One of the things that even as we chose those particular statistics, which was coming from a pretty reliable source, SAMHSA is a great resource. Things might change a little, but even over the last few several decades, there's trends, and they stay pretty consistent. But as a just personal, if the question is more personally related, where we work in a residential and outpatient program, I'd say we do see spikes, of certain drugs that will come and go, something that comes into fashion, I suppose. And as mentioned, the increases in opiate use is really the other than alcohol use, which is consistent and will always seem to, maybe not always, but definitely seems to be the most prevalent, opiate use. And heroin is part of that, and prescription medication usually begins before the heroin use many times. Yeah.
The next
I hope I
question,
answered that question.
yeah, that's great. The next question comes from John, and he was also referring to statistics early on. He was asking about the 92% that do not seek alcohol treatment. Is
Mm-hmm.
this an awareness issue, or about maybe they don't recognize they have a problem, or is it just socially unacceptable? What is it that that 92% of that group who has an alcohol problem aren't seeking treatment?
Mm-hmm. Yeah, that is a lovely question, a beautiful question, and I have to admit that I don't have anything firm to answer that question. I only have, my experience and more like narrative report. I wonder if there's something more in our statistics that we could actually find and see. But, it would be really hard to survey the 92% and tell us a little bit more, but I do believe accessibility is a big piece of it. Treatment centers, we we have our own wait lists, so there's definitely a need, and we know that accessibility, insurance and coverage, paying for it, and could definitely be a barrier. And I think whoever asked that question, I'm sorry, what was Mr. Name?
It's
I
John.
believe that John, thank you. Yeah, John, that it is definitely an awareness issue as well. But some of the things that we even talked about, like people's fears, what would happen if they go to treatment? Will they lose their job? How can they pay for it? Financial concerns are a big issue. Yeah, and I think education, we are finding more stuff in social media and popular culture about addiction and kind of destigmatizing it. So perhaps we'll see some different trends in the future as that continues. But there's a lot of concerns about being open about your use in the society.
The next question comes from Tom, and it's actually kind of a good segue. down a little bit, but related to the last one a little bit from what you said, what unique things are employers doing that you've seen to financially support the employees that have addictions that they're aware of? If you have seen
Financially
anything.
support them?
Yeah, financially supporting. Have you seen anybody do anything unique other than offer maybe a health benefits package that
Mm-hmm.
allows for some subsidy?
Mm-hmm. Wow, that's a good question. I don't know if I've seen any employers do anything more unique financially. That's an interesting question. I mean, other than give, yeah, I think the best thing, the time off. So not only are they getting health insurance coverage or something that would help them pay for the treatment itself, but being able to allow for the enough time off. Treatment is not, unfortunately, a week long. It can take many, many weeks, many years even. And so working with someone's schedule and if people move into outpatient, that means they have to do their day job, their paid employment, as well as this other job of going to treatment. And so time, flexibility around schedules, and confidentiality is a big piece. But I can't think of any other real financial strain. Given I'm not a business owner, most of my experiences, I mean all of my experience really is working with concerned significant others of people, but I do know that when folks come into treatment, employment is a big thing, and folks need to work. We know that having something to do, not only something to do, but something to feel excited about and proud about is a big motivation for continuing to stay sober.
This next question actually came from several different people, asked kind of a different way, but the most recent one comes from Colleen. She asks, if an employee will not admit to an addiction problem, but you suspect one, whether a coworker, a manager, HR person, what is the next step to take?
Mm-hmm. Right, yeah, definitely. I would say that your tools are to stick to the facts and acknowledge the things that you that are tangible. So observing and describing the behaviors that you're noticing, and based on your relationship, right? So if you are a coworker, you can certainly not only speak about the impact on the job, but perhaps the impact on the relationship, and using using compassion in your approach, but acknowledging this is occurring, we notice these changes, and what has to happen to continue to work there or to continue to save the relationship. Either or both are important in the workforce, and so what needs to change? And that's that balance between the observation of the facts and the boundaries and the limits and what has to continue to occur. And so when someone cannot make the connection or will not disclose the connection between the addiction or the use and their behaviors, then you can keep it out of the personal in that way and just move forward and a more, I guess, non-confrontational and without having to do the, you don't need to prove anything, I suppose is what I'm trying to say.
Mm-hmm.
Yeah.
I'm going to sneak in my own question if you don't mind, as the next one.
I don't mind, and I wanted to. I wish there was a way for me to know if that answered that woman's question.
I think that was great, and we can even follow up if it doesn't answer the entire question. But I think that was great. So my personal question would be, as and this is more related to alcohol than anything else, it's become more and more socially acceptable, especially in the workplace, where some of these startups and tech firms, the way they attract people is by having kegs and wine available, and around 3 or 4 o'clock they might allow it, and as part of their policy or philosophy as far as like how they operate. So my question to you is, how do you kind of treat that if there may be some people that overuse that or overabuse it, and you're aware of it? How do you sort of handle that when it's socially acceptable in the office?
Yeah, well, that is a trick. So, which is kind of, we only put together that one slide about the office party or what have you. So if there's no policy about it, but you want to, because you want to welcome that there's the company culture welcomes having alcohol in certain events, and so I think there might be some opportunities to consider, like as an agency, if we're noticing that first of all, nobody else is responsible for someone's choices around drinking or drinking heavily. So I want to, if I feel that wasn't mentioned, and I need to mention that. A company is not responsible for someone's overuse of alcohol or drinking or addiction. So, however, if the company culture supports it and they want to allow for everyone to do it, there was just this one, suggestion, recommendation, which is, ensuring that there's a limit to it, so that the flow, if that means that, everybody, brings a little wine to their meeting, that there's only enough bottles that would be enough for everybody to have a little drink, or some, whatever that appropriate limit might look like for that agency, versus kind of the bottomless opportunities. And again, if that is not something that can be done, then it comes out to a little bit more of the impact of someone's overuse of alcohol. And so some people cannot drink normally, and it doesn't mean that everybody should have to not drink, if that makes any sense. So yeah, I think that's a real discussion to have as an agency, probably, to talk about what values do they want to continue to keep, and what values are they willing to adjust and change, and can we reinforce? There's some agencies that not only normalize it, but it's almost required as part of their job, is socializing with alcohol, and I understand that to be important. And if you have someone who's unable to drink normally, so to speak, slang, that would be a very challenging position for them to stay in. And so someone might need to choose their health over that job, which can be hard.
I'm going to sneak in one more question from the audience, and then we'll wrap up. And this might be kind of a big one and maybe too early to tell, but I do like the question. So it comes from Kathy, and she asks, how has the legalization of marijuana, and specifically to Oregon and Washington — I think most people on this webinar are probably based in Oregon and Washington, so this is specific to them, but how has the legalization of marijuana really impacted substance abuse? Is it too early to tell? What have you seen?
I would say that and I think it is a little bit too early to tell. There are some, local organizations that work in certification of our, alcohol and drug counselors that are really trying to tackle those questions. But from what we've seen, not much. Yeah, not much. I mean, we aren't seeing an increase of folks needing treatment who are using marijuana. Folks that form a habit to a drug such as marijuana or alcohol, legality doesn't seem to have a huge impact on whether or not a person becomes addicted to it, if that makes sense. I mean, we still see that nicotine and alcohol are the most abused items, and they have been legal forever. So, not forever, but yeah. So we haven't seen it, but it may. Again, I don't have the numbers to prove or back up that question. I appreciate the question, though.
Yeah, great. Well, I want to thank Betony and DePaul Treatment Centers. Great content. Thank you for engaging us in the Q&A. I know just helps us all become aware of what's around us, and I think that's I'm very appreciative of you jumping on here and doing this, and hopefully the audience feels the same way. We have a ton of resources available at Xenium: articles, white papers, free content. Go to xeniumhr.com/blog. We have podcasts, old webinars. The links are on the screen there. And if you need to reach out to me or to Betony, I've put both of our email addresses right there on the slide on the screen. I want to flip through these next slides real quick. Betony put together a nice list of resources. You guys will get the slides in your hands soon enough. So, but I wanted to make you aware of these are on the back end of the presentation. So these are some awesome resources and references. So again, thank you so much for being part of this topic, attending, and Betony, awesome job today. Really appreciate it.
Thank you, Brandon. Yeah, it was fun. You were right. Thank you so much for inviting us.
Awesome. Well, have a great day, everybody.
Yeah, have a great day, everybody.